Hello everyone, this is Dr. Shilpa Chaitanya, consultant radiologist with special interest in fetal and gynecology imaging. I am associated with Motherhood Hospitals, Sarjapur Road. Today I am talking about role of 3D ultrasound in gynecology imaging. 3D ultrasound is a special technique where a two-dimensional image is converted into a real-time three-dimensional image. There are many applications of 3D ultrasound in gynecology imaging. Firstly, diagnosis of congenital uterine abnormalities. These are spectrum of disorders where the uterus cavity and shape are abnormal. For example, a septate uterus. In this kind of uterus, there will be a septum dividing the uterus either completely or partially. This type of abnormality may lead to recurrent miscarriages. The next application of 3D ultrasound is assessing the acquired uterine endometrial and myometrial pathologies. Adenomyosis, fibroids, polyps and synechia come under this entity. For example, fibroids. 3D ultrasound helps in localization of these fibroids, and it also helps us to assess if the fibroids are causing any pressure effect on the uterine cavity. This effect may lead to infertility issues, bleeding irregularities. 3D ultrasound helps us to localize these lesions. This study is known as fibroid mapping. Next application of 3D ultrasound in gynecology imaging is placement and localization of intrauterine contraceptive devices. Normal intrauterine contraceptive device is seen in the upper uterine cavity with its T limbs extending into the bilateral cornua. 3D ultrasound helps us in localizing these IUCDs. Sometimes there will be malpositioning of the IUCDs. Sometimes the IUCDs may be embedded into the myometrium. All these abnormalities can be well diagnosed on 3D ultrasound. The next application of 3D ultrasound is localization of the pregnancies. While most of the normal pregnancies can be localized on 2D ultrasound, some complicated pregnancies pose a diagnostic challenge, such as tubal ectopics, angular pregnancies, cornual pregnancies, interstitial pregnancies, and caesarean scar ectopics. 3D ultrasound helps us to detect these pregnancies early and also helps us in proper management. In 3D ultrasound, there is a new technology called Sono ABC. This is an automated software where the ovarian follicles are auto-calculated. The number of follicles, size of the follicles, volume of the follicles can be precisely known with this technique. The other applications of 3D ultrasound are endometrial volume calculation in infertility cases and pelvic floor weakness assessment in cases of uterine prolapse, rectoceles, cystoceles and enteroceles. 3D ultrasound is a fast evolving technology which holds a greater potential in gynecology imaging. This is also cost effective and less stressful to the patients. Thank you.
Motherhood Hospitals. We care like no other.